Switching back slightly to the pathophysiology of how the PML occurs with Natiluzimab, this is a EAE model, once again demonstrating the use of animals and our understanding of this disease. This is from a pig, but this is how Natiluzimab works. Before you have treatment, you have all of these PBMCs, which is basically these inflammatory cells in your brain. You give them Tysabri and you stop all these inflammatory cells, all these little white dots coming into the brain. And that's good for your MS. The problem is that some of those white cells are clearing out the JC virus and stopping PML developing. So that's the downside of stopping the white cells getting into the brain. So what do we know about JC virus and PML? Well, we know that something like 60 to 80% of us have a JC virus infection. We may clear it, some of us. We may end up with a persistent infection, but certainly once we're exposed to it, we then have seropositivity. Then if you suppress the immune system, such as if you have a leukemia or something like that, then you probably get mutations which make it neurotropic. It goes to the brain, into the CNS, and then you may then develop PML. Particular to the brain, probably with treatments like Tysabri, we block immunosurveillance. That means that JC mutations, which are neurotropic, then get into the brain and then develop PML. And again, here are just some slides of PML. And part of the challenge for us, for patients who are receiving Tysabri, and it has to be added, other drugs coming online for MS. Certainly rituximab is associated with PML. We may yet see it with cladribine and other immune modulating drugs. And this is our challenge. Those familiar with these pictures will notice this is an MS-looking brain with these white matter plaques here, but also this lesion here, which is slightly atypical. This is early PML. And that's why the MRI scan is going to be used to try and pick up, along with the clinical presentation, any suggestion of PML developing. Anybody want to have a guess what this is? Emma or Giles, MS or PML?
Yes.
Well, this is a tricky one. I mean, this patient is just straightforward MS, but you might see someone with an attack like that and you might think that looks very much like PML, and that's part of our challenge as clinicians and radiologists, that we've got to try and distinguish between these two conditions.